Hi, my name is Keith Wise. I'm the Executive Director of the Rocky Mountain HIDA. Our HIDA supports the Rocky Mountain states of Colorado, Utah, Wyoming, Montana, and over the last few years, our teams have been working hard to strengthen our prevention infrastructure by establishing closer relationships between both public safety and health partners to address our region's substance use and prevention needs. Our strategy, with the invaluable technical support from ADAPT, has included bringing hundreds of key stakeholders, such as yourselves, to the table, not only to immediately address our community's rising numbers of overdoses, but to also concurrently implement the most effective data-backed prevention programs to help reduce dangerous drug use, promote healthier lifestyle choices, to also save lives. For our region, groundbreaking activities such as drug information sharing and coordination symposiums, more effective youth engagements, and co-hosting with ADAPT, a first of its kind youth prevention institute in Denver, Colorado, that brought together experts to help train students in the most up-to-date prevention strategies, are just a few examples of our increased efforts. I am super impressed and proud of the prevention work being accomplished throughout our 4 states. I cannot overstate the importance of these contributions in our overall counter-drug strategy. Like many areas in the country, we are heavily focused on reducing fatal overdoses caused by illicit fentanyl use, and a big part of that is educating our youth on the potential dangers of this drug. So it is with great excitement that I introduce to you this next session that will share more about a recently launched Colorado campaign designed to message to youth about fentanyl using a social norms approach. The Rocky Mountain HIDA fully supports this effort, which is an excellent example of a comprehensive approach by our friends at the Colorado Attorney General's office, launching a campaign with a broader prevention strategy across an entire state. In just a moment, you'll have the opportunity to hear from 3 panelists. First is Jamie Feld. Ms. Feld serves as the Director for the Opioid Response Unit at the Colorado Attorney General's office. She has 17 years of experience in behavioral health, with the last 9 years focusing on addressing the opioid crisis in Colorado. Ms. Feld is an epidemiologist by training and has served at various governmental agencies such as the U.S. Department of Veterans Affairs, the Centers for Disease Control and Prevention, and the Colorado Consortium for Prescription Drug Abuse Prevention. She has led efforts in international, national, state, and local levels of the public sector. In previous roles, she provided subject matter support for the opioid and other substance interim community and the Behavioral Health Transformational Task Force at the Colorado General Assembly. Our next 2 panelists, Eric Anderson and Brandon Zelansko, both represent SE2, a leading behavior change marketing and communications agency based in Denver. For 25 years, SE2 has focused exclusively on changing behavior, social norms, and policy, creating a positive cycle they call perpetual movements, change for good. Mr. Anderson is a principal who co-founded SE2 a quarter century ago. He has led behavior change projects focused on limiting harm to youth from marijuana, tobacco, and opioids, among other issues, while promoting positive social norms. As a father of teens and young adults, he recognizes the unique array of challenges facing young people today and is committed to supporting the next generations. He is also a former journalist. Mr. Zelansko is a principal and co-owner of SE2. He leads behavior change campaign strategies for SE2's clients. Over the last 13 years, he has supported behavior change campaigns addressing opioid prevention, tobacco cessation, youth vaping, STI testing and treatment, and mental health promotion. Mr. Zelansko is a Colorado Governor's Fellow and serves on the board of Colorado's Young Leaders. In closing, please keep up the incredible work out there, and I thank you for all you do. On the behalf of ADAPT and the Rocky Mountain HIDA, please join me in welcoming our esteemed panelists, Jamie, Eric, and Brandon.
Good afternoon. My name is Jamie Feld, Director of Opioid Response at Colorado Attorney General's Office. I'm honored to have our campaign recognized at this incredibly valuable summit. I first met Dr. Lori Peppard at a HIDA event put on by Director of Rocky Mountain HIDA, Keith Weiss, and their overdose response strategy, and was impressed by their approach and expertise in the prevention field. I was amazed that the best experts on the front lines of fentanyl prevention were found at a law enforcement conference, and I immediately wanted to learn more. I want to thank Keith Weiss and Rocky Mountain HIDA for providing us with consultation with ADAPT and Dr. Peppard that led us to the development of this campaign. I'm here to represent Colorado Attorney General Phil Weiser, who has made addressing the opioid crisis one of his top priorities while in office. The Opioid Response Unit, which I lead, administers the funds coming to the state from opioid settlements over the course of 18 years. Colorado is anticipated to receive more than $770 million in funds from distributors, pharmaceutical companies, consulting firms, and other entities that have harmed our community by distributing, manufacturing, and marketing opioid pain relievers as non-addictive. We are fortunate in Colorado to have an Attorney General that has been committed to addressing this crisis in a nuanced and thoughtful tone. He has also led the nation with several other states in committing to 100% transparency in the use of these funds. You can visit our website to learn more. Furthermore, he was taking early action to respond. My predecessor, Director Heidi Williams, was hired on the nation. Our goal and our duty is to administer these funds to ensure accountability, transparency, equity, and impact. When addressing this issue, we know there was no silver bullet. We have to look at the range of responses from prevention to harm reduction to treatment in the criminal justice setting, and importantly, recovery, using the voice of people with lived experience. This is one small piece of a larger puzzle. Similarly, Colorado has a decentralized process for distributing funds. 20% goes by direct allocation to local governments, 60% goes to regions. As a result, 80% of opioid settlement funds in Colorado go to the local level, where we have a legacy of strong local control and programming. Working at local public health, I saw the value of smaller organizations and local governments having access to these funds. 10% is through an infrastructure share that is intended to hit the hardest hit parts of our state. Only 10% is held by the state government, which results in a less centralized approach that we believe builds on communities' existing capacity. Since we have limited funds at the state, we have to be extra careful on how to utilize our state share to complement existing local and regional funds. So we had to think about why a prevention campaign and how to come up with a prevention campaign. So how we came to a prevention campaign. The Attorney General was committed very early on to listening to the voices of people impacted by substance use, including families who have lost loved ones. This Friday, we're having another meeting with families from all backgrounds to hear what their needs are. And overwhelmingly, what we heard the need was around is to address services and provide resources and materials for youth to address substance use and simultaneous mental health challenges. We heard this to come up time and time again from a variety of sectors: law enforcement, family members, youth themselves. Second, prevention is cost effective. You heard it earlier, but you'll hear it again. Youth prevention programs have a very favorable return on investment. For every dollar spent on effective programming, $18 is saved in later costs. Where else can we as decision makers have this type of long-term and cost-effective impact? Johns Hopkins, Bloomberg School of Public Health, and the Principals Coalition issued a guide on effective uses of opioid litigation principles. Colorado was awarded as the inaugural winner in the effective application of these principles. These 5 principles include spend money to save lives, use evidence to guide spending, focus on equity, and develop a fair and transparent process for deciding where to spend the funding. The last principle, which we touch on today, is invest in youth prevention. We wanted to ensure that our spending reflected national best practices and the large body of evidence to support this type of work. I think you also heard earlier that a more recent review by the Washington State Institute of Public Policy shows that at least 18 youth prevention programs produce benefits of at least $10 for every dollar invested. That said, the same review demonstrated the importance of choosing the right program, maintaining fidelity, because some programs could generate negative returns. And so you can see on the slide, one of our goals was a do no harm mindset when charting this new course. We also thought how we could amplify local efforts rather than each region or local government creating their own distinct campaign. We thought we could reduce costs on overhead by having a more centralized but tailored approach. In addition, we could promote evidence-based practices at this level. This is just one piece of the puzzle. We are investing in a wide range of opioid response activities. A large portion of our first year funds will be distributed to our tribal partners. We are investing in medications for opioid use disorder in the criminal justice setting. And we have launched an innovation grant funding peer recovery and evidence-based youth programming aside from this campaign. We are identifying ways to merge this youth campaign into other grantee deliverables. When crafting the RFP, we had to bring it to competitive bid, and we aimed to think of a couple of aspects. First, we knew that we were not the experts. At the Colorado Attorney General's office, we don't have either youth prevention experience or a large marketing background. As a result, we consulted with Dr. Lori Peppard and her team, and we knew to do this right, we couldn't just rely on our gut. We needed to rely on experts with behavioral health and media experience who were willing to put in the legwork of doing the research in advance and throughout the campaign. We had good partners already in Colorado, but we didn't want to duplicate or create competing campaigns. We wanted to ensure statewide coordination, and we wanted it to involve youth voice in the creation, which you'll see we did through working with Rise Above youth partners. We wanted this to have diversity through geography, race, ethnicity, sexual orientation, and other factors, and make sure that we were addressing it in a culturally responsive manner. And as you'll hear from our experts from SE2, we wanted to be thoughtful, whether this is through focus groups, message testing. There were options for a more formulaic approach, but we recognizing that more testing was necessary as fentanyl youth prevention awareness was an emerging field. We are happy that a Colorado-based company applied that had experience in social behavioral health sphere and partnered with a local youth prevention program, Rise Above Colorado, that had a great reputation in our state. I come at this as an epidemiologist with a background in public health. I have a sister in recovery from substance use, and I have worked as a direct service provider back in 2013 when there was not anything known as the opioid crisis. At that time, we saw people in their 20s coming in with heroin use disorder. I have to say, like some of you in the audience today, social norming did not come intuitively to me. For many years when I worked at the local level, we had to try to get people and the press to pay attention to the opioid crisis. So it felt at first counterintuitive to take the approach to say most youth are not using. I had seen people I worked with lost to overdose, including young people. But I truly believe in messaging grounded in science. I believe in the evidence from our peer-based studies and some of the speakers that we heard earlier today. And I find it particularly compelling for our audience of youth in the 10 to 14 age range and their parents, as well as the social norming message around bystander activities that promotes the concept of naloxone, the life-saving opioid antidote. One day, social norming clicked for me when I heard it compared to friends don't let friends drive drunk, and how it has been incorporated into friend groups as a way to know and identify what it means to be a good friend. My hope is that we will be able to provide more robust analysis of the campaign, not just campaign metrics, but also change behavior in the population to demonstrate our impact. This issue is too important to get wrong. While we know the majority of youth are not misusing substances, the risk is too great for our future generations to not rely on tested approaches to make an impact. And I feel deeply committed to getting this right for my sister and all the youths and families I've worked with. On behalf of Colorado Attorney General Phil Weiser, who wanted to be here today, I want to thank you for this opportunity to share the campaign. We welcome your feedback, input, and questions. We're very fortunate to partner with HIDA, ADAPT, SE2, and Rise Above Colorado. I hope you reach out to us for resources and materials. And as our Attorney General Philip Weiser often quotes, the opposite of addiction is not sobriety, it's connection. For my sister in recovery, she says connection is the key to keeping her in the right state of mind every day, and it's what's changed our family. For others, it's the key to protecting against substance use when times are hard or to not use for the first time. And I think you'll find that positive message of connection as a through point in this campaign. I'll turn it over to our experts at SE2 to talk about Connect Effect and to tell you more about their very thoughtful approach, which we were grateful to be a part of. Thank you for this opportunity, and I look forward to questions.
Thank you, Jamie. This is Eric, and I'm privileged. I feel privileged to be able to work with you and HIDA and ADAPT and Rise Above Colorado on this issue. There's nothing more important that we could be focusing on right now, and we brought all our best thinking, but also a really open-minded approach to this, where we wanted to follow the science wherever that led, and ADAPT helped us do that. The first thing we did was decide to look at the landscape, make sure that we identified where we could be of most benefit and where things were already happening. The last thing we wanted to do was to send people conflicting messages, overlapping messages, adding to clutter that somehow confused the messaging or the framing of this to our key audiences. And it is a crowded ecosystem, not just on the issue of opioids and opioid use prevention, but also on the broader issue of behavioral health and youth prevention. And that's happening everywhere from local public health agencies, the federal government, of course, individual nonprofits like Rise Above Colorado, but many, many more, and the Colorado state government with the Colorado Department of Public Health and Environment and the Colorado Consortium for the Prevention of Prescription Abuse, for prescription abuse prevention, excuse me. We knew that also there are important efforts focused on adults. That includes harm reduction, ranging from the use of naloxone, as Jamie highlighted, but also the testing and other strategies to reduce harm from drug use and opioids. And then obviously focusing on opening doors to treatment and providing support for recovery. So these were all happening at the same time, and many of them the campaigns were actually emerging while we were doing this research. So we recognized that we would not be doing this in isolation, and our efforts had to complement the other things that were going on and not duplicate things, because that's just a waste of money and can be actually confusing. So we did gap analysis. And as Jamie said, the Colorado Attorney General's office had already identified that need, but we wanted to make sure that we took that research a little bit further to ensure that we were providing we were serving an important niche that was not being served by existing campaigns. And that's where we focused on specifically not just the youth prevention, but the social norming approach.
All right, so I'm going to talk a little bit about how this campaign, or as part of this campaign, we were really developing a new playbook on how to address this issue with our target population, that primarily being young people here in Colorado. And what was kind of unique about this project is that we entered it with a hypothesis, which is a little atypical of the way that SE2 approaches nearly all of our youth-focused and public health focused campaigns. We really thought that we were probably going to need to take a more fear-based and loss-framed messaging approach that really highlighted the stark consequence of experimentation with pills. But we were concerned. We were concerned because we know that from the evidence base that fear-based campaigns are not typically well supported in the research in terms of their efficacy. We also know that fear-based campaigns can be really stigmatizing, and while they are memorable, I'm sure we could poll the audience here and we would come up with a lot of the same ones that we probably heard in our childhood. They don't change behavior. And so we had this tension of this, hypothesis about maybe this is the way that we need to go, and reconciling that against, some legitimate concerns about the evidence base and what that said would be the most effective. So while we had those reservations, we moved forward with research to validate our hypotheses. And so with those assumptions in place, we then really dove into wanting to kind of test this assumption. And as Eric and I think Jamie articulated both, our research approach, and as a fundamental component of how SC2 approaches our work, is that it needed to be rooted in community and partner collaboration. And I think in other sessions today, you've heard about the importance of interagency collaboration in these efforts and really hearing from communities in the preparation of campaigns like these. And so what did we do? We consulted with national experts, many of whom you've heard from today, or I presume you will hear from later today. And we also evaluated the strengths and weaknesses of other campaigns. This is what Eric was talking about when we did a little bit of an ecosystem analysis in terms of what are the campaigns that we had here in Colorado, what are the campaigns that other states have developed around these issues, and then what are the other federal, national efforts that are going on, and what does the preliminary data say about the efficacy of those efforts? And as we were going through this process, it became clear that this is where our hypotheses started to break down, fortunately. And it started to become really clear that fear-based campaigns were not the right approach for our work here in Colorado. And so as part of this process, social norming really emerged as a promising approach to opioid prevention. And we know that to be true with other issue areas, with tobacco use and vaping and other substances and other unhealthy behaviors. We know that this is a proven approach. And as we were going through this process, which started close to a year ago, the evidence base was still coming into fruition in terms of whether or not this was going to be true also of addressing the youth opioid response. So with that in mind, we sort of shed that past hypothesis of, maybe we need to go down a fear-based approach. And we really started to lean into this idea of a social norming focused campaign. But it was important, again, because we wanted to make sure that we were including community and partners in this, that we wanted to make sure that that also felt appropriate to them. And so we conducted, not only reviewed existing Colorado research, but also conducted some primary research with community partners here in Colorado. And we did that in a number of ways, including some statewide polls that included both parents and youth. This is where we also worked really closely with some of the regional partners that the AG's office is funding, as well as some of our nonprofit partners that we worked on with many different campaigns, to make sure that we were hearing from some of the underrepresented communities, to really make sure that their voices were heard in our formulating the strategy. We also had discussion groups with youth. So we brought young people to the table to really understand how they interpreted and perceived the messages that we were proposing to put out around social norming, to make sure that those messages were resonating to them, and that where there were concerns or apprehension about the believability of some of these messages, we were able to talk a little bit about that and vet that, and how do we address that to make sure that the message is believed, and hopefully the actions that we are proposing, which you'll see later here in some of our creative, are executed. So our conclusion through that whole process was that our hypothesis was very much wrong going into this project. And fortunately, we settled on our social norming approach, which Eric is going to talk a little bit more about.
Yeah, and the last thing I want to do now is belabor the definition of social norms. I think you've got that by this point in today's program. But I just wanted to just do a level set here and quote from the Professor Wesley Perkins, the other Dr. Perkins, who notes that humans are influenced by peer norms. Peer norms are one of the strongest predictors of behavior. And peer norms are greatly overestimated when it comes to substance use. And protective behaviors are typically underestimated. In short, everyone does not do it. As the introduction said, I was a former journalist. And again, this is counterintuitive for those of us who have experiences changing policy or working in the news media. If you are sent by your editor to cover a house fire and you say, I came across 499 homes that were fine, and that's how you write your story, that will not get you advanced through the newsroom hierarchy. But in this case, we are focusing where youth are making positive choices and looking out for each other and supporting each other. So we got a handle over time with this sort of cognitive dissonance that what feels might maybe natural in terms of our focus is not necessarily supported by science, and that the positive social norm is. I also wanted to give a shout out to the Montana Institute, who we consulted with this campaign and offered, along with ADAPT, some really helpful insight to support our approach. So what we found, and we found from both our own original research as well as from research that had already been done, in this case in Colorado research, we wanted to find specific Colorado research where youth were surveyed. We found that youth overwhelmingly make healthy choices. That's not just related to pills, but much more broadly in terms of the various choices they make for the support their health. But at the same time, and our partner Rise Above Colorado talks about this, they overestimate the percentage of their peers who make unhealthy choices. So they make healthy choices and they overestimate the people around them who make unhealthy choices and underestimate those who make healthy choices. When it comes to communicating with youth, they want facts, they want science, they don't want scare tactics, and they know the difference. And this one's really important. We must avoid perpetuating stigma. So we know that when it comes to some of the campaigns focused on adults and focusing on treatment and recovery, one of the most important things to do is reduce stigma. And we know that judgment is ineffective at changing behavior, and that stigma can actually encourage risky behavior. For example, if someone uses drugs alone, they're more likely to be alone if they experience an overdose. It may also deter them from seeking support, or may interfere with them getting support from providers or family members or loved ones or community members. So stigma obviously is counterproductive for many of the goals we have. But we knew that we would take a social norm approach that at the same time had to be aligned with the goal of reducing stigma. And we'll talk about that a little bit more, but we do believe that you can reduce stigma and promote social norms by taking a carefully crafted approach and walking a line between those two strategies. And then finally, we know that connection, and we know this from some of our other work, is, as Jamie said, a powerful upstream prevention factor for a variety of risky behaviors, from drug use to sexual behaviors or other things. So connection, whether that's peer-to-peer, youth to youth, or peer to parent, or youth to parent, or youth to other trusted adults, is a powerful upstream prevention factor.
Yeah. So following our ecosystem review, our review of the evidence base, our primary research, talking to the community and the partners that we were trying to engage through this campaign, we settled on a few of the following campaign objectives. These include the following. So the first is that the campaign really needed to focus on increasing knowledge of the positive social norms, and we have some examples of that here in a moment. We also wanted to increase knowledge of fact-based information. One of the things that we found is that there is a lot of misinformation, particularly among young people, that is important for them to know to make healthier choices as it relates to this issue. We also know that we wanted to show how to be an active bystander. In the previous presentation, I know spoke a lot about that, so I won't belabor this, but obviously that is a positive social norm that we would want to potentially influence, but not only elevating it as something that is an alternative, but also providing the messaging around the skills of what that could potentially look like if you are a young person in that situation. We wanted to also increase confidence in protective skills. So these include an obvious one like refusal, how to say no, if this is not something that you're interested in. And we wanted to normalize open conversations, not only between peer to peer, so that when a young person sees a friend engaging in a risky behavior like this, they feel like it is a normal thing to talk to their friend about their concern, as well as from young people to their parents or their trusted adult. And finally, because again, we know about the importance of the power of connection as a protective factor, really for any unhealthy behaviors, we really wanted to elevate that as a key component of the campaign, which is one way you see manifest in the name of the campaign itself, the Connect Effect. All right, so who were we focusing on? This too was established through our research. So we have some other audiences that are not included in here, but for simplicity's sake, our primary audience for the campaign is skewing a little bit younger. We found that there was a real opportunity with youth ages 10 to 14. So this would be like late middle school, very early high school, maybe, and their parents and trusted adults. And one of the reasons, why we thought that was really important is that, this younger cohort is less likely to have experimented. That's clear in the data. And that by building these refusal skills and the bystander skills early, before they are exposed, they are better prepared when faced with a situation where they may be asked to use or consider using. So these are really skills that if we can impart early, we could see a whole generation of impact as these young people, age into high school and ultimately into young adult and then ultimately adulthood. As a complement to the campaign, though, we also wanted to make sure that we were communicating with parents and trusted adults. We don't want to put parents and trusted adults into a position where young people are seeing this campaign, they're seeing these messages, and they're going to their parents for information and their parents are unable to answer the questions. So there is a small component of the campaign that does focus on doing some outreach to parents and trusted adults of young people ages 10 to 14, so that they're prepared to have those conversations and support the young people in their life. Additionally, campaigns for 15 to 18-year-olds when kids start to get a little bit older tend to look a little bit different than campaigns for younger kids ages 10 to 14. And so while, it's important that we're reaching out to them, they are a secondary audience in this campaign because a 15 to 18-year-old campaign would look and sound a little bit different than, the campaign that we've developed here. And the last thing that I just wanted to note related to the connection between youth ages 10 to 14 and their parents is it was a strategic decision to have two components of the campaign that reached both of those audiences, because we know that kids ages 10 to 14 are heavily influenced by their parents. Whereas when kids become older, they're much more influenced by their peers. And so by having that complement to the youth campaign, where parents are also educated on these issues, we're hoping that there's some good synergy there between those two audiences, so that while kids are listening to their parents, at least more so than when they get older, they are prepared to do that. All right, so we're going to take a look at now, finally, what you've all been waiting for, a look at some of the campaign materials. And we're going to start by showing you one of 3 commercials that we produced with real Colorado youth, talking about the social norming messaging. And we'll talk a little bit about that after the video plays.
Our generation faces great challenges,
but we also show great strength.
We turn to each other for support.
To make healthy choices for our minds and our bodies.
That means not using pills not prescribed to us. 88.5% of Colorado youth don't use substances to cope with or overcome negative feelings. And they'd also stop a friend from experimenting with pills.
That's the Connect Effect.
You.
Me.
Us.
Looking out for each other.
Speaking up.
Making healthy choices.
Be a part of the Connect Effect. Get tips to protect yourself and your friends at connecteffectco.org.
Elevating some of those important social norming messages in that version of the campaign. There are other versions of the ad that talk and speak to, more on the bystander behavior side, on the refusal skill side, as well as just an ad that's really focused on the number of young people who are not using. And so I think it is established in the evidence base that, social norming campaigns, we shouldn't hang our hat on one message, because if one message is out there and some number of kids don't like it, I mean, the campaign becomes completely irrelevant to them, right? And so it's really important, we feel, in these campaigns that we have a variety of different social norming messages, so that if a young person doesn't like that ad, doesn't like that message, doesn't believe it, there are other ads and other messages that they can get behind. For example, the bystander behavior. If they don't believe the number of kids that are using is true, at least they can believe that a very large majority of young people would take action to support a friend through any number of different bystander behaviors. So these ads are running on Instagram and TikTok rather heavily. And we've been very encouraged with the preliminary results of the campaign, overperforming in terms of the number of young people who are viewing and clicking through to our campaign website to get more information, to take quizzes, and to download and access a number of materials that are designed to actually be saved to their phone, so that if they find themselves in a situation where they are not comfortable or they need some support, those resources are in their library and they're ready to go with that information. So just to show you a couple of the other campaign materials, and there are a lot, so we're just showing you a few here. This is a look at some of the youth posters that we've produced. So we've developed a whole toolkit that serves as a complement to this campaign. The toolkit has been made available to all of the regional partners, the 19 of them across the state of Colorado, as well as shared through our other networks to all of the youth serving and parent serving, not all, but lots of youth and parent serving nonprofits across the state of Colorado. As part of this too, we don't cover it a lot here, but would welcome any questions that you have about it. Have paired this paid media campaign with a really innovative kind of mini grant opportunity, where we will be in the remainder of this year and into the beginning of next year providing kind of micro grants of a few $1,000s to our partners, as to nonprofit community-based partners, as a way of incenting their participation in the campaign, to post these materials in their clubs or facilities, share them out on social media, share them through their newsletters, through basically tactics that are inaccessible to us from a paid media perspective, right? Like, we can't buy placement in community nonprofit newsletters and stuff like that. And so this is a way that we can kind of break in and use those really trusted messengers to convey those messages to our target audiences from an organization or a person that they really trust. And so this is a look at the three posters, and I'm sharing it here because it shows you the variety of different messages that we have in the campaign. The first, most Colorado youth would try to stop a friend from using a pill that could contain fentanyl. Second is the social norming data around use. 9 of 10 Colorado youth aren't misusing pills, and 88.5% of Colorado youth do not use substances to cope with negative feelings. It's teeny tiny in there, you probably can't see it, but I heard it in the previous presentation, so I wanted to point it out that these data are also sourced in our materials, as well as over on the website when young people go to explore more information on how to exercise some of these various behaviors that we're promoting. And this is a look at some of the parent materials, and there's some youth materials in here too. I mentioned the materials that you can download and save to your phone. These were designed both for parents and youth and parents. So we have a number of different resources that are available for our different audiences. In this case, it's some examples of how to have the conversation with the young people in your life. So a parent material. In the middle, we have some examples of our display ads. And over on the right is just one quarter of the website that we developed for the campaign. I'll note that we also, through the evidence base, found it to be really effective that we provide tools that allow people to kind of test their knowledge and explore. And so it's not shown here, but there are some interactive quizzes that are on the landing page where once you get a little bit more information, you're encouraged to explore that and test your knowledge. And that too is a learning opportunity, and hopefully a fun one, a learning opportunity that young people and adults want to participate in to get more information about these really important issues. And then lessons learned. And Eric, you're on mute.
Yes, and I did want to note that Brandon showed materials that with the parent materials we produced were both provided in English and Spanish. And that's what is important to given the diversity of our population here in Colorado. So we're still learning, but what we've learned so far is that we understand that fentanyl's lethality, the fact that experimentation can be deadly, makes it fundamentally different than other substances. Yet we conclude, and the science supports, that the principles of social norming and connectedness still apply. Even though it's fundamentally different than other substances, these other principles still apply. That again, as I mentioned, positive social norm approach can be compatible with anti-stigma goals if we separate the behavior from the people. So we always want to use person first language. We want to tell stories and humanize people. And we always want to stress that the person is not defined by the behavior. So we're talking about choices that youth are making, but we're not stigmatizing people. And then again, ensuring that we build on and don't add to the clutter of existing campaigns in the ecosystem. And then last, I think we heard this a few times, stressing the urgency of this while focusing on positive choices that most youth are making. So again, we don't want to create complacency, obviously, by saying that most youth aren't doing this or would protect their peers. But we want to stress that while that's true, it's critical that we all come together and we all have a role to play to address this deadly epidemic that the nation's facing. Ready?
All right, there we go. So in terms of our next steps, we continue to test and learn as the campaign progresses. We're looking at how the various messages that you saw in some of those materials are performing on their own, as well as against one another. And it is our intent that as we move into the second year of our contract, we will be tweaking some of the messaging and targeting, not only based on the data, but some of the things that we're hearing from the community in terms of their comfortability around communicating some of these messages. And so, we will continue to explore that and create new iterations. It's one of the great things about running a digital media campaign. It's very easy to update and test in real time. We are also working with the AG's office to explore some third-party evaluation of the campaign, which is not built into our contract, but definitely something that their team is thinking about and interested in pursuing. And we are also, as I mentioned, through our mini grant opportunities, working to engage local partners to amplify the campaign, those who have already received settlement dollars, as well as those other community partners who reach audiences that are really very difficult and tough to reach with a traditional kind of paid media campaign. And lastly, I believe we have included a QR code here, which maybe is a little easier to access than the description Laura was providing in the previous presentation, that you can snap a photo of here, and it will take you to access our toolkit of all of the various materials, of which there are many, about the campaign. And there's some information there if you'd like to get in contact with any of us to learn more, or how to repurpose these campaigns potentially in your community.
All right, wasn't that great? I'm telling you guys, this is such a brilliant example of how to apply some of the things they just learned about. And you didn't even, I just want the audience to understand and be very transparent. We were in discussions with you, but the tool had not been developed yet. This is something that you also kind of went on a journey through and discovered on your own and began to apply on your own and work through some of those nuances and various dimensions of it. So it's just really neat how both have arrived in the same place and that this was such a good example. So thank you so much, Jamie and Brandon and Eric, for sharing all the details and for really just helping us understand the way you thought about it, the process that you went through, and how it fits into this bigger state level picture for opioid response. All of you did such a beautiful job describing those various facets. And we do have a few questions. Just for the audience, we have put the website itself. We've got the fancy QR code that you had access to through Brandon, but we also have put the website for you old schoolers like me that just want to click on a link and go there. And I encourage you to explore that website in detail. We have enjoyed really seeing some of those things be brought to life in the videos and the various images that Brandon showed. All right, first question. Is this campaign able to be used by others, by other coalitions, groups with their own logos and data? Basically, if you created a template that others could use. Talk about that.
Well, I'll start, and I say in principle, I think that it certainly could be. The goal of these campaigns is to create a framework. We would want to stress that any community would be well served by bringing in their own data points and ensuring that both in terms of the imagery, the style, the language, the race and ethnicity of the people shown, and again the local data points, that it feels local and authentic, and that it resonates with their audience. But I think the framework we've established is something that would be universally applicable.
I would add from the AG's office that we would welcome for people in other communities to share out these resources as they see fit. So feel free to share the website on social media, share it as widely as you'd like. We are really committed to making sure these messages get out there. And our goal is really to address this crisis versus, claim ownership by our agency as the funder. And so we do want you to share them widely. We could put our information in the afterwards. So, if you did add logos or added some sort of organizational information, we would just send that to our comms team to make sure that they get approvals. But we would love for you to get this information as widely as possible.
Yeah, and if I could add that our background from our origins as a firm is on tobacco prevention, and I think the tobacco prevention, including youth prevention campaigns, have really demonstrated that you don't have to reinvent the wheel every time, that finding best practices and retagging campaigns can be a great way to build on success.
Thank you all. And I just want to reiterate that using it as a template makes a lot of sense because it applies what's been suggested and we urge you to consider in the tool. But the data definitely needs to be yours, needs to be your data to be relatable to your youth so that they understand that it's their peers. And that comes in line with the statement that Dr. Perkins made earlier around always make sure you're showing the source of your data when you provide these various messages. Okay. We had a question come in early on. They were very curious about the content that was included in the information outreach to the parents, to the caregivers. I know there were a couple of examples at the end. Can you talk a little bit more about that?
Sure. I can take that. Others can add on. So most of the content for parents and trusted adults focuses on a few things. One, how to have effective conversations about these issues. And we know a lot from our other work on other youth-focused campaigns that also include parents. The parents have a lot of apprehension about, one, approaching their kids, because maybe they don't have a strong enough relationship to feel like they can approach them about these tough topics. And two, a surprising finding that we consistently get in these campaigns is that parents also really want to have fact-based information and understand the issues before they feel confident approaching their child. So there's really two parts to that. Do I have the skills to have the conversation and the relationship? And do I have the knowledge about the issue to feel like I can approach my kid? Because oftentimes they feel like their kids are more educated on these issues than they are. They're closer to it. And so there's a lot of information around, here are the facts, a lot of information around, here's how to have the conversation. And then there are supplemental and supporting resources, including one that we didn't talk at all about yet. And that is how to use and access Narcan and naloxone as a harm reduction strategy, how to keep that at home, why you should keep that at home, and really focusing on, wanting to, one, elevate that as an option, which many parents don't even know about yet, and two, destigmatize the idea that having it in your home somehow incents young people to want to experiment more. And so you will find that there are a number of resources there that touch on those three topics, as well as a smattering of others, but that's the primary focus.
Yeah, and Brandon, if I could quickly add that as a parent of teens and young adults, you often will have a conversation with them, and they will send every signal possible that what you're saying is uninteresting and boring, and that they'd rather be doing other things. But we want to stress to parents that, again, the research shows that youth actually do trust their parents to look out for their health, and that even though it may not appear like they're listening, they may actually be listening. And so to tell parents that it's actually worth doing, because teens themselves say that they value this information from parents and other trusted adults.
Thank you all. That kind of leans a little bit into this concept of connection, right? And youth trusting their parents does indicate a level of connection that they have with them, right? And Jamie, I'm really appreciating, you even wrote down Attorney General Weiser's statement about the opposite of addiction is connection. And just sitting with that for a minute, we've had a question that came in around, well, we all know that in order to engage youth, right, they need to feel like it's going to be meaningful and like important for them to engage with us in this process. But what was your strategy for kind of promoting that connection and engaging the youth, bringing them to the table when you were developing this campaign? How did you get them involved?
I'll just go first and I'll pass it over to our partners. That was a key criteria in selecting our vendor. We really wanted to ensure that that was included in the awardee. And so one aspect that we really liked about their approach was that they partnered with Rise Above Colorado, which has a teen action council that was involved in a variety of the meetings, including the meetings around the message testing. I'll let them go a little bit more into the detail, but that was a key aspect that we wanted to ensure was a part of whoever we awarded for the contract.
Yeah, so in addition, and I'll talk a little bit about how we engage the Action Council in a sec, but in addition to that, SC2 also employs a youth advisor as part of our staff, who is sitting there ready to consult with us throughout the process of the development of these campaigns. And again, as I mentioned, who is a staff person. So both our youth advisor and Rise Above's Teen Action Council, as well as some of the young people that were fielded from the regional abatement council partners, participated in a number of things, including helping to participate in the research. But one also overlooked thing is they actually reviewed the research questions So before we fielded a poll, we actually sent those questions out and we asked young people, do you understand these questions? Because we're not going to get good data if young people don't understand the questions that we're asking. So they helped to advise on the questions that we were asking in the surveys and in the focus groups, participating in the surveys and focus groups, brainstorming with us when we were doing the creative concepting, when we were identifying which materials would provide the most value as part of the toolkit. Some light participation in the testing of the materials once we had them kind of drafted, the website, so on and so forth. And I guess what I would just underscore is that every step in the process of developing a campaign for young people should include young people in the process. And that's a key tenet to how we approach the development of these campaigns.
Wonderful. And I feel like that's been kind of a theme that has surfaced and emerged throughout the summit, not one that we actually had headed into the summit really honing in on and focusing on, because we had other main things we needed to lift. But that one has arisen in almost every presentation we've heard so far. And so I appreciate you articulating that so beautifully.
Yeah,
Brandon.
Laura, the term that we didn't make up, but that is a good reminder to all of us, is nothing about us without us, right? If you're communicating with an audience, make sure that you're including the audience in the creation of those communications.
Yeah, and I just add that, it was really important to have geographic diversity. So SE2 did provide us maps of where those focus group questions came from, the racial and ethnic background, sexual orientation, identity. And so we wanted to make sure we weren't just getting those that were easiest or most accessible, or, look like us in certain ways or act like us. I think it's really key to make sure that you're having a really reflective group of folks participating. And I think there's even more we could do on this front.
Well, we've had a question come in that I think is really important around, did you translate this? Did you translate this into any other languages? Understanding kind of Colorado's youth population and including not just the youth, right, but the caregivers. Did you translate it? And if so, in what languages?
Well, I'll say two things on that. One is we don't like to talk about translation, which suggests that you create something and then you translate it into another language, but we use the term transcreation, where you build things from the start that are in different languages, but also reflect cultural differences and reflect visual cues and other things that would resonate most with target audiences. Every campaign, of course, is a matter of directing resources, limited resources, in the most impactful way. In given Colorado's demographics, the predominant language spoken other than English is Spanish by a long shot, and so. But we also knew that most young people in middle school or high school are likely to be at least bilingual if and conversational, if not fluent in English. So conserving resources, we created the parent campaign into English and Spanish, knowing that some kids might be fully bilingual, but their parents are more monolingual Spanish speakers at home. So we translated the parent campaign into English and Spanish, or transcreated the parent campaign into English and Spanish, and not the youth campaign.
Thank you for that. I think we're all leaving with a new term, transcreation. Really appreciate it.
Yeah, I mean, the idea with that is that if it's a 10-step process to create some marketing materials, don't add translation as step number 10. Start from the beginning, both by researching and communicating with your target audiences, including in their languages, and start building the campaign from the very beginning to reflect those audiences' needs and how to most effectively communicate with them.
That makes a lot of sense. Very similar conceptually to building in sustainability right up front and thinking through how you will sustain any new initiative right in the beginning, instead of waiting until the end to talk about, now what are we going to do when funding runs out, right? All right, we have a few other really important questions that I'm not going to be able to get to today, but you all have very graciously provided your emails, and I encourage any participants who would like to reach out to do so. I want to just take a minute. Thank you. Thank you, Eric. Thank you, Brandon. Thank you, Jamie. This was really important. It was really important. And one of the questions was, is any other state doing anything like this? Have you seen any other campaign like this at the state level?
We looked and we were unable
Yeah.
to find a campaign that had this sort of messaging on this issue.
On this particular issue, yeah, in this particular way. Okay, well, thank you so much. We're going to give the audience a much needed break. So thank you for joining us today. And we've got one more session, and it's going to be the bow that wraps up the entire summit with Carlton Hall coming up after break here. We'll see you back at 3:45 Eastern Time. See you then.